What is the cost of lies? This is a case study about an interesting little paper I saw circulating around the internet. So the other day, I'll admit I was on Instagram like anybody else, and one of these accounts got recommended to me. I don't follow them. I don't know why accounts I don't follow show up in my feed. However, I was interested in what this was showing. I am a research scientist, bioinformatician, and I mainly study cancers and drug resistance in cancers. So I like reading about research and seeing what people have to say from around the fields. So this caught my eye, especially because this wasn't a traditional scientific account. It's Nordic Shadow, and they post a lot of things about politics. They seem to be right wing. I had to peruse through their profile, but they were highlighting this paper that came out, the most highly censored clinical paper of the pandemic, demonstrated COVID-19 vaccination is the cause of death at autopsy of 73.9% of autopsies after vaccination, which is a crazy statistic. So, what they're saying is that in 73.9% of people who died after getting the vaccine died because they got the vaccine. They're implicating the COVID 19 vaccine in the fact that they died. And of course, the comments are some of the most intellectually stimulating, perhaps in the course of human events. So, anyone with half a brain knew that this, without any report, this was a massive planned operation, of course. Pure Blood, Button, We Will Never Forget, Good Times. A lot of other papers with this have been censored. So I thought this was an interesting dilemma. One side is claiming censorship. However, I did check the paper on Elsevier, and it has different reasons for taking it down. So the dilemma I'm presenting is this censorship of the truth or refutation of lies? And what are the costs of lies is the thesis of this little recording here. So if it's a censorship of the truth, the implication is that the scientific establishment is suppressing the truth, and there's some sort of movement against the spread of this damning information. It would put a very bad light on the government and our health system. However, if this is a lie and the system took down this paper to refute it, the system is preserving the truth as we know it. It is working to not allow the spreading of false information and lies. The cost of lies seem to be very dramatic, as these people, they can even read the paper. This is just, on Instagram, of course, and people are already charged. If this is a lie and they see this, of course, they just read the headline and what this guy says, then they're charged for a while, and it will take a very large amount of negotiation, if that, to convince them otherwise, that they have been deceived. It's a known phenomenon in psychology that people will receive information at first without a problem, without hesitation. Okay, this is true. But to tell them that they were lied to, you have to fight them tooth and nail to correct them. People don't want to be corrected that way. So that is the cost of lies. It embeds, it manifests, it spreads pervasively throughout society, and it makes the spreading of the truth hard to hear because people don't want to be proven wrong. It's very difficult. So the background of this paper, it was recently withdrawn. The article had been withdrawn. The authors did not want it to be withdrawn. The editors did, and it was because there were inappropriate citation of references, inappropriate design of the methods, there's errors and misrepresentation, and a lack of factual support for the conclusions. And there was no citing of disconforming evidence. So they're basically saying that this study was not only conducted unfairly, but it was heavily biased towards the conclusion that they found. So what you should always do, like reading a scientific report, is not like reading a book or a newspaper, for instance. There's a lot of consideration you have to do in order to decide to read the paper. So one of the first determinants of a paper's authenticity, meaning they're not biased towards a particular conclusion, they're just studying the phenomenon and seeing where the pieces lie, is by looking at the affiliation. So these are the authors for the publication here. I won't read them out loud. I hope you have the ability to read them for yourself. But some red flags are Truth for Health Foundation and their implications to the McCullough Foundation. So the way the papers work is the first author here usually wrote the whole thing. Everyone in the middle kind of co-authored. Maybe they wrote a couple sentences, did some advising, gave some programming, helped make one of the figures, and the last person is the most senior, so they're directing the research. So that is Peter A. McCullough, who is in charge of the McCullough Foundation and has a hand in the Wellness Company. So we have Nicholas Holtscher here, who is a Master of Public Health from the University of Michigan, and he got a Bachelor of Science in Pre-Health Professional Studies from Oakland. So I saw this on LinkedIn. So what we want to see is, are these people experienced in what they're studying? Because that's also a red flag. You don't want people working on rockets who have never studied engineering or that sort of thing. So he was a medical assistant, a lab technician in dentistry. He was a founder of Think It Loud, which seems to be some sort of publication, and he worked for about a year as a research intern and has been an epidemiologist fellow at the McCullough Foundation for about a year and 6 months, I guess. So, based off of his credentials, I don't presume that he has a strong scientific foundation. He has only been really doing science for about a year in 6 months. You would presume someone with a lot more authority, experience, and wisdom would need to carry out such studies. You know, not that the new people can't find exciting things or shake the environment up, but there needs to be a certain amount of expertise, a certain perspective in coming to conclusions here. And this person does not seem to have any sort of molecular biology experience, pharmaceutical science experiments, medical experience. He is a epidemiologist, possibly by title, not by rank or profession. I don't see that he went to medical school at all. So that raises some concerns in his authenticity. And if we look into the McCullough Foundation, so they have a video here. I won't play because I don't want to waste your time. So what this foundation does, they are a nonprofit that wants to focus a lot on education. So they talk about you know, the vaccine and a lot of things in the news cycle, and they're obviously very biased against the vaccine for some reason. However, they have this on their website. So doctors promoting COVID-19 vaccines today are comparable to doctors who promoted cigarettes in the 40s. That's a very biased conclusion against the vaccines. So if you see a paper of them looking at the vaccines, what do you think they're going to find about them? One of the other resources I was consulting in order to make this presentation for you cited that Hodgkin and McCullough, who are authors, Roger Hodgkinson and Peter A. McCullough, who supposedly authored this, are also affiliated with and have financial interests in the Wellness Company, a supplement telehealth company that sells unproven treatments, including for purported protection against vaccines. So that seems to be the business model here. They have this website where they are protectors of the public interests. It's all part of their rhetoric to make you feel like they're fighting against insidious establishment which tried to poison you, and they sell the antidote to it. So, the uneducated person would see this and may be tempted by these people. Oh, they're fighting the good fight. I should protect myself and buy their product. So really, there's many immoral things being conducted in this study just by looking at who wrote it, which is a big problem. Not just in this paper. In a lot of publications today, people have their own interests, and they like to sway the truth, of course. So if we get into the study and we look at the data, so they scraped PubMed and Science Direct for articles talking about autopsy and myocarditis for people that got the COVID-19 vaccine. So you can look at this tree here that shows how many cases they were able to find and reports they're pulling information from, and their whole study on assessing that 73.9% of people that got the vaccine died from it is based on causality in each case was assessed in accordance with independent review by 3 qualified physicians with experience in cardiac pathology. And if 2 people agreed that there was a probable cause linked to the vaccine, then it was determined that there would be a death. So basically, 3 people are looking at autopsy results to determine a cause of death, which is not very scientifically rigorous. It's quite stupid, actually. So, I mean, you're just looking at things, and it's a consensus of 3 people. There's no broader sense of authenticity, especially if these people are biased, let's say, to the data, then that bias is being exhumed in the data and their analysis. So these three people may be compromised. How can we trust their judgment? Would you not be skeptical if three random people you've never heard about, affiliated with a company who is biased towards wanting to sell their treatments, came out with this study? It's just a lot of red flags. Things aren't right. They're not scientific. This is not a scientific study. It pulls things from science, which a standard publication or study would do in terms of its rigor. The N equals is how many samples. You want to have a large sample size to take away deviations. However, it's using those to embellish the central flaw of this entire study, which is the fact that it's not based on anything quantitative. It's all qualitative. It's people looking at things and telling you what they think, which is hilarious. It's not scientific. So let's get into their analysis. This is what the entire paper is predicated on. So it's these two figures. So on the left, cases affected by organ system. So 93% of all the cases had only cardiovascular malformities. And on the paper below, we have a time distribution here, where within the first 7 days, they're saying 75% of the deaths occurred within a week from the last vaccination. So if you're not critical about how the methodology was performed, you would think, oh, okay, if within a week 75% of people died from getting the vaccine, then that must be causation. However, it's not quantitative. People aren't assessing these things rigorously. It's three biased people looking at data and saying, oh, yeah, that this person died from that. There's no quantifying feature of that. In fact, what the article I referenced previously talked about, they said that the original people that put out the data, the autopsy data, said there was no link between that. You know, how do you validate causality in this circumstance? If it was true, if we use our own intuition here, if it was true that 75% of people die from a vaccine, and if we extrapolate that to the hundreds of millions of people that got the vaccine, and 75% of people died, there would be mass extinctions on the planet. You would notice. You wouldn't have to go to these papers to find that out. What? Hundreds of millions of people around the planet would just be dead. I'm pretty sure you would know about that if this was true. You wouldn't have to read about that. And then it does the other dishonest thing, which it cites results from other more creditable papers. I haven't thoroughly assessed these papers, as I have this one to assay the results. So the paper up here is looking at evidence of spike protein in cardiac tissue. So spike protein is what the COVID vaccine actually creates in your body whenever you receive it. The spike protein are those little protrusions on the coronavirus molecule, and it allows your body to make antibodies towards that protein, so your immune system learns how to track and target the actual coronavirus. So what this is saying is that, oh yeah, the spike protein was in cardiac tissue, and they were able to see that from immunohistostaining. It's like, okay, there have been reports of myocarditis. However, the prevalence is very low. I will return to that point in a second. And it's also showing evidence of CD4 and CD8, which are T cells. The immune system is in these cells as long with the spike protein, which means that if the protein is in the heart cells along with T cells, that's inflation. That's causing myocarditis. However, it's pulling this information to say that 75 the deaths were caused from myocarditis and sudden deaths, which is absurd because in the predominant amount of people that received the vaccine, not only did more than 99% of them not die, but myocarditis, yes, is a verifiable issue and may have causality with receiving the vaccine. The prevalence is low, like 0.0001% of people that receive it, or something to that degree. I don't have a direct citation in front of me. Receive it may get myocarditis. However, it is not fatal in most cases, which means that, oh yeah, you're a rare case that does get myocarditis. However, you don't actually die from it. Now, to the person that's not versed in pharmaceutical science, oh, okay, you just said that the vaccine may cause myocarditis. Okay, so whenever drugs or vaccines are pushed out to the mass population, they're originally studied in small controlled samples in phase 1, 2, and 3 testing to see if it does fight the indication that it's meant to fight. And the phase 4 clinical studies, or whenever it's pushed out to the mass population, you can't really study the variants of the entire population whenever you're in 1, 2, 3 testing, but the FDA just wants to see safety and efficacy. Yes, some drugs get out there, and whenever they're testing a diverse population, they get pulled from the market. That's how our system works. However, with the COVID vaccine, if we remember, it was fast tracked through the FDA, and some people have issue with that. Oh, they didn't properly study that. However, most cancer vaccines, including one of the most landmark cancer drugs ever, Keytruda, was fast tracked. And really, what it comes down to is that it's a whole study called pharmacovigilance. Yes, some people may have adverse reactions to this on the population level. So you give something to a lot of people, and some people are bound to have a negative reaction. If we were to apply the same logic that this vaccine is dangerous because, like, a very, very small amount of people develop this negative side effect of it, we should also ban peanuts. A lot of people are allergic to that and go into anaphylaxis, so we shouldn't have it even available on the mass populace. Of course, this is not talking about coercing people into eating peanuts as people were coerced into the vaccine, which is a whole other issue besides from the science at play. So really, it's not that dangerous as the study is presenting. It's very biased in its methodology and its data collection. And this was the conclusion that this paper came up. So hilariously, this looks like it was made in PowerPoint. So the vaccine directly causes myocarditis in everybody and leads to you just randomly dying. I mean, first of all, it's not a very well made figure, if I may comment on that. However, as I just talked about, yes, very small people may develop myocarditis, and a subfraction of that may die from that. However, we really must assess on the population level, does the benefit of the vaccine outweigh the con, which is training your body in order to fight the vaccine. Some people think, oh, I got the vaccine and I still got the coronavirus. Yes, but the severity of getting the coronavirus was not as severe as not having any immunity. A lot of people say, oh, the second time I had the coronavirus wasn't as bad as I had the first time. Yes, because your body was trained to the vaccine, or not to the vaccine, to the coronavirus. And that's the whole point of the vaccine, to train your body. You're not immune from getting sick. You're immune from getting the whole effect the first time. So for this study, as I said before, scientists who conducted many of the autopsy studies came to opposite conclusion of the articles of this biased paper, and there was no relation between cause of death and the vaccination. Furthermore, the authors weren't, even if the authors weren't biased, this study does not show causation. This just shows really some random ass doctors think, okay, people died from the vaccine, so this is what caused it. It's opinion based. They only looked at published autopsy and necroscopy reports relating to COVID-19 vaccination. If you look at only at the autopsies of those related with the vaccine is involved in a high proportion of cases. Basically, if you're selecting samples, you don't select from the effect group. You need to select from a whole population of people that receive the vaccines. So what this study is doing is taking a sample of the most severe cases and saying, oh, these people got myocarditis and died, that 0.0001% of the population, and saying, oh, it's very deadly to these people. Yeah, of course. But if you pulled like the millions of people's like biometric data from this, that the observed report that they're seeing in this paper, even if you could call that a result, is very minuscule. Vaccine safety surveillance systems and other studies from across the globe have found that serious side effects can occur, yes, but they are extremely rare. So what is the verdict from all this? Every lie we tell incurs a debt to the truth. Sooner or later, that debt is paid, by Valery Legoslov. He was one of the people who worked to solve the Chernobyl crisis, and I don't know if this quote is actually his. It's from the Chernobyl series that was put out. So what is this trying to say is essentially that there seems to be two sects of people forming in our society: the people that have the agency and the due diligence to seek out the truth, which is unimpeded by opinions. It's always true, no matter what you believe. And then there is the my truth people. It's quite hilarious that someone would use the term my truth when the word opinion exists. But these lies, these papers that get put out accrue, and they pull more people and sympathies to them, and it makes it harder for the truth, the empirical, unbiased truth, to reach people's hearts. And it does not unify people, it divides people very much. Maybe a lot of this can be contributed to other times the people were lied to, especially if we go back to the 2000s with the wars in Iraq and Afghanistan and the sowing of public distrust. These events today are the implications of that, a very divided and distrustful society. And what it leads to is dysfunction. And we are now accruing so much debt to the truth, it is very hard to find what the truth is, one that doesn't care what you think. It is all becoming opinionated. But what we need now today are a resurgence of people who are the just of society. They only care about the truth, finding what is inherently true, and only seek to explore and advance human knowledge without any biases. Whereas the unjust, such as the authors of this paper, seem to corrupt and pervert the truth for their own financial or social implications. What we need now is for people to really cooperate with honesty, integrity, and always tell the truth. Even if you don't have aspirations to be a scientist or to perform such investigations like this, it is always advantageous, just as your mother told you when you were a child, to always tell the truth. Thank you.